In this module, we're going to be talking about classroom and environmental accommodations. By the end of the module, we hope that you will gain some new strategies that ensure a learning-friendly environment in practice and some ways to reduce trauma triggers in the school environment. In the classroom, OTs and other therapists can play a role in making environmental and task modifications that better suit the child's needs. This could look like anything from providing preferential seating near a door or the front of the classroom, or maybe near the teacher or a friend, wherever is most comfortable for the student. It can also look like providing a break pass when needed to walk down the hallway or stand outside of class to cool down, maybe getting water or engaging in a mindfulness activity in a designated area. It can also look like implementing a comfort or a cozy corner or zone. This is most likely a familiar concept for you all, and it is so customizable and awesome. An example might be a rug in the corner of the room where students can take off their shoes and cuddle up in a weighted blanket or a comfy chair with a dimmed light tent around it. The possibilities are endless. Another way that therapists can help is by helping the teacher provide a predictable structure for the day. This can be incredibly regulating and calming for a child impacted by trauma and can look anything from using a visual schedule for reminders, using verbal reminders, ensuring directions are clearly stated or even written down, or providing advance notice of changes in the schedule. Making sure to check in frequently and to ensure the child is understanding and engaging with what's going on, as well as ensuring that there is a safe adult mentor who is accessible. This could be a teacher, the therapist, a peer educator. It would really depend on the resources of the classroom and the relationship with the individual student. Other compensatory strategies might be using assistive technology or seating, such as a wiggle seat, a fitness ball, or a rocking chair, reducing visual or auditory distractions with decluttering or headphones or other tools, allowing access to self-regulation tools such as a stress ball, gum, or fidgets, and using a visual schedule or providing extended response or assessment time.
Before lunch and recess, a child can have extra time and warnings to help with the smooth transitions, or student can have buddy or friend so that a child can feel comfortable with these transitions. If needed, the child can rehearse transition in a private or low stress environmental with a safe adults manner or with a therapist. To reduce extra stimuli, the child can eat at a different location or with a safe adult mentor. Also, child can play in a smaller area or preferred area with a preferred activity to reduce anxiety. To increase engagement and more sophisticated social communicative behavior, the safe adult mentor can be present for adult remediated peer interaction. For homework and task accommodations, the child can have alternative format or assignment to meet the child's specific needs. It can be smaller or shorter or less written work. If needed, caregiver can transcribe the student's work or can help with writing so the child can have reduced amount of written work. The child can have extended time or no time tasks with the advance notice. This is an example of the fire drill accommodation. Before the fire drill, the child can be prepared by social story, picture story about the fire drill, or watch a video with a low volume at first. As the child feels comfortable with it, the volume can be increased each time watching the video. If the child has sensory issue, the student can wear noise canceling headphones, but need to make sure the child can hear the teacher. It is important the fire drills are keeping them safe, not making them scared. So it can be in the street action, prepare, plan, remind. In this module, we just covered classroom environmental accommodations. Next, module 9, we'll talk about the therapist self-care. Thank you.